Elliot Richardson on the line with us. He's the president of the Small Business Advocacy Council. SBACIL.org is their website. And Elliot, welcome to the program.
Hey, Tom, thank you so much for having us on. I truly appreciate the opportunity to chat with you.
Thank you. Do I have this right that you guys are trying to put together a consumer-owned health insurance cooperative there in Illinois?
Yeah, we're not only trying to do it, I think we're pretty much on the 5-yard line, Tom, trying to run this thing into the end zone. So that's exactly what it is. We're trying to, through the power of critical mass and patient-centered care and innovation, bring down the cost of health insurance for small business owners and our employees by putting together a cooperative that doesn't answer to shareholders but answers to these small businesses in that cooperative.
So you're all going to collectively get together and own this thing. Are you going to administer it the way that, for example, a lot of unions and self-insured corporations do, use one of the large insurance companies to do the back office stuff, or are you going to do that yourself?
You know, the plan is to start with a TPA, so there wouldn't be an insurance company involved. The plan would be to start with a third-party administrator that would be able to use our expertise to run the insurance company, like a lot of self-insured plans. Right. Ultimately, the cooperative, as we build a network and as we get more established, would essentially run the cooperative on behalf of the consumers, on behalf of the small business owners.
That's great.
And you know, luckily there's a lot of very, very smart folks, doctors and surgeons and business people who are trying to put this together and really bring down the cost of health insurance, along with just put everybody together to run a big cooperative. Right.
So, for example, United Healthcare, the CEO there makes more than 1,000 times what his average employee makes. They've got over 100 people who make over $1 million a year. That's pretty mind-boggling. You're just going to cut all that stuff out and say, you know, we'll just hire some guys with green eye shades and you know, who like to read spreadsheets to you know, men and women to handle the bookkeeping and the paperwork stuff here and you know, and run this thing not for profit.
Well, yeah, you run it non-for-profit, and I mean, the more disturbing thing about what you said about the United Healthcare CEOs is that, you know, there's members of the SBAC who have 10 employees whose health insurance has gone up 36.1% over the past year, and they have absolutely no reason why. So I think you start with transparency. There's also a ton of wonderful people in the medical profession, doctors and surgeons, who are tired of the health system running the way that it runs. You know, doctors being paid by the test as opposed to patient and really working on the patient. And certainly I think it will be important to have people running this without any profit. But on top of that, I think we have to be innovative. We have to bring wellness. We have to bring technology. We have to really focus on the root of what causes healthcare rates to rise. Because as long as they keep rising like this, it is going to consistently be a job killer for small businesses. Yeah,
well said. Are there other organizations around the country that are doing the same, Elliot? Are you part of a movement, or are you just you know, a lone entrepreneur out there, or whatever the word would be?
Well, no, actually, interestingly, the funding for these cooperatives come out of the Affordable Care Act. So there was a part in Obamacare, the Affordable Care Act, whatever you want to call it, which has a lot of money set aside in the form of a federal loan, a loan. Now, they're not giving you the money, they're loaning you the money to have the reserves to start these self-insured cooperatives. Wow. We actually have support from both Senator Durbin and Senator Kirk to put this together because obviously people across the state, across the political spectrum, I believe have come to the conclusion that small businesses must have the opportunity to compete with the 4 large insurance companies that are raising our rates. Now, these cooperatives have been formed in states as red as Wyoming and Utah and as blue as Massachusetts. So, you know, this is a real opportunity to change the game.
Yeah, I don't disagree. Elliot Richardson, SBACIL.org is the website, the Small Business Advocacy Council. You're doing great work, Elliot. I wish you the very best.
Thank you so much, Tom. And again, thank you for giving us the platform to get this message out.
My pleasure. Bye.